The meeting's now live.
Thank you very much, Anna. Good afternoon and welcome to the virtual Health, Wellbeing and Social Care Portfolio Decision Meeting. I'm Councillor Matthew Winnington, the Cabinet Member for Health, Wellbeing and Social Care, and I'm chairing the meeting today. We are meeting virtually in response to the limitations placed on governance by the COVID-19 pandemic. Until recently, the law stated that all members had to be present in the room to make formal decisions at meetings. However, the law was amended in response to the COVID-19 emergency and councils are able to hold public meetings virtually. This will be in accordance with the local authorities' coronavirus flexibility of local authority meetings regulations 2020 number 392, the regulations. Members of the public are invited to view this meeting and there has been the opportunity for written representations to be submitted. Those present are requested to keep their microphones on mute and to only turn them on when they are called to speak. Members are requested to keep their cameras turned on at all times. Officers are requested to turn their cameras on only when they are presenting their reports or answering questions. If anyone would like to speak, please write their name, RTS, standing for request to speak, in the chat function. And I'll be monitoring that as we go through the meeting. If there are any technical difficulties, we will endeavour to resolve these and where necessary, have a brief adjournment. I would now like to invite those present to introduce themselves. I will read your names out, starting with members. Can you please reply by stating your name and saying present? Please can I ask everyone taking part today to confirm that they are present. So I call on Councillor Matthew Atkins. Please turn on your microphone and introduce yourself.
Yeah, Councillor Matthew Atkins, present, Chair.
Thank you very much and welcome. Call on Councillor Graham Heaney. Please turn on your microphone and introduce yourself.
Thank you, Matt. I'm Councillor Graham Heaney. I'm the Labour Group spokesman on health, wellbeing and social care.
Thank you, Graham. Very welcome. I call on Councillor Jeanette Smith. Please turn on your microphone and introduce yourself.
Councillor Jeanette Smith, present.
Thank you very much, Jeanette. Very welcome. So that's everyone is present. So Anna, can you let me know if there are any apologies for absence?
There's Innes Richards and Helen Atkinson, and Helen is represented by 3 colleagues.
Thank you very much, and we will come to those as we go through. So what I intend to do then is as we come to officers, we'll ask them to introduce themselves before they do their reports. I think that will be the way I'll do that today. So members, are there any declarations of interest? No?
Sorry, Chair, I can't type as quick as you're moving on. So,
sorry.
My declaration of interest, I'm a full-time official of Hampshire Branch Unison.
Thank you very much. I appreciate that, Councillor Jeanette Smith. Okay. So I've been asked, so Public Health have asked if we can do their agenda item first, which is agenda item 5. So that is what I will be doing. So we will take agenda item 5 first, and then we will take agenda items 3 and 4, which are both adult social care. So I now call on the 3 public health officers if they could introduce themselves and then present the public health response to COVID-19. So Claire.
Hello there, Claire Curry, Consultant in Public Health.
Thank you very much, Claire. Very welcome. Dominique.
Dominique Latouche, Consultant in Public Health.
Thank you, Dominique. Very welcome. And finally, Matt Gummerson.
Thank you, Chair. Matt Gummerson, Lead for Public Health Intelligence.
Thank you very much, Matt. Very welcome as well. So over to you, if you can introduce Gender Rights and Fire Public Health Response to COVID-19.
Thank you, Chair. Shall we start with the intelligence part of the paper, Matt, if you're happy to do that?
Yes, certainly. So this is section 5 in the paper, which just briefly summarises a number of the ways in which we use the assorted COVID-19 data intelligence that we have, sometimes in partnership with colleagues across Hampshire and the Isle of Wight, and the reports that we then use from that information. And attached as Appendix 1 to this report is a example of the weekly intelligence summary that we put on the City Council website. Happy to talk you through that summary if that would be useful. Appreciate that members may not have all seen this as it was circulated late due to an error on our part. Apologies for that. I think it's a format that you're all very familiar with. In terms of the data as it was reported on Friday, we're continuing to see cases coming down. So that's we had 125 cases in the previous 7 days, and the total cases just under 14,000 since the start of the pandemic. And our daily average number of new cases are down to 16 a day. Similar picture across Hampshire and the Isle of Wight. So we report on the data from the other authorities just to ensure that we can identify any potential regional issues before they appear in our data, but nothing to add there, very similar trajectories to ours. And then we also report on the 7-day rates per 100,000 for Portsmouth and a number of comparators. And we've been doing this for many months now, and it allows us to track progress in Portsmouth. So our 7-day rate on Friday was down to 58.2 per 100,000 and coming down nicely at 32% down on the previous 7 days. And again, a similar picture across much of the southeast. The map on the slide, section 1.3, shows other parts of the country. Yeah.
You're not screen sharing.
I wasn't sure if you wanted me to, or whether you just want to use the reports that you've got.
Sorry, I can just screen share. That's fine.
Okay, apologies. I should have checked before we.
That's all right.
Before we started. I've been doing this long enough.
So I think it's just useful for anyone watching, so they can just see the nature of the report, because they I don't think they would really see. Yeah, they wouldn't really see this in any other sort of setting, actually. So I think it's quite helpful for anyone watching to be able to see what it is that we as members sort of see, and keeps us up to date with what the how the numbers work and how we see things.
Of course, hopefully you can see the slides now.
Yeah, absolutely. Yeah, thank you, Matt.
Great. Okay, so just quickly recapping what I've already showed you. The first slide I talked to was the overall numbers in Portsmouth. As I said, they're coming down nicely since the peak in mid-January, and down to an average of 16 new cases a day over the past 7 days. And then these are the spark lines I was describing that you couldn't see, showing the similar trajectories across the pandemic for the 4 Hampshire and Isle of Wight authorities. And again, you can see coming down very similar patterns in Southampton, Hampshire and Portsmouth, and levelling off, having come right down to very low numbers on the Isle of Wight now. And then the point I was just at there was talking about the 7-day rates per 100,000. So Portsmouth at 58.2 per 100,000. You can see for most of those comparators, it's coming down by between 30 and 40% on the previous 7 days. And then the map shows the rates across different parts of the country, and the colours on the map change at various points. They're now using bands of around 25 per 100,000. So the red and then the dark red are areas that are still seeing rates over 100 per 100,000. And as you can see, we've included Rotherham as one of the comparators there, because not only is it continuing to see high rates, it's not improving in the same way as other parts of the country. There are a number of areas with enduring transmission, which is a cause for concern. We then look in more detail at the Portsmouth rates broken down by 15-year age bands. So in the chart there, you can see the red line represents the over 60s rate, and you can just see the slight increase over the last week or so in that rate, driven by
Yeah, I'll open it up just as it's a natural thing. Members, any questions on the Matt Atkins?
Hello, yes, I was just curious that you mentioned that there was a slight uptick in the infection rates in 1 or 2 care homes. I mean, most likely those residents have probably a significant number of them already been vaccinated. Do you think this is just people catching the virus in the period when you're still vulnerable after the vaccination, or do we think there's some concern it might have been that effective, or is vaccination rates not as high as they could be in Portsmouth care homes?
I mean, I know that Andy's on the call and may well want to jump in. I would say, as far as I'm aware, they were picked up through asymptomatic testing, and there are good uptake of vaccinations within our care homes, but it's not 100% yet. And it's certainly, we do know that having had the first dose but not the second dose in many cases, they won't. And even with the second dose, you don't have 100% efficacy from the vaccines. There is still a risk of picking up the virus. So I would say it's probably a combination of some that may not have been vaccinated, but also just highlights that there is still the opportunity for people to test positive even after vaccination.
Graham.
I thought I saw Andy's hand go up actually at one point. He did a virtual hand. Does he want to come in?
Yeah, in you come, Andy.
My apologies, Chair. I was using the virtual hand and not the RTS. Apologies. Just to confirm from an anecdotal point of view, Councillor Atkins, what we have seen, there's been 2 care homes where there's been an outbreak in recent times, and there's been a limited number of people go to hospital from those homes. They both, those residents in those homes have nearly all had the vaccine. So whilst it's difficult to make a definitive statement, what we're seeing anecdotally is it does appear that the vaccine helps have a less serious impact from the illness, certainly on those two swallows. Not a summer mate, but that's an anecdotal example, if that helps.
Thank you. Yeah, that's interesting.
Graham, back to you.
Yes, thank you. Matt, just a quick question about the lower than average death rates. I mean, do we have any idea yet what might be influencing that, or is it too early to tell?
As in why the deaths in recent weeks have been lower than average?
The overall death rate.
Too early to give a definitive answer, but I would suspect that a large part of it is actually due to the very low numbers of flu deaths that we're seeing this year. It's one positive of all the restrictions that we've endured as a result of COVID-19 is it has had a remarkable effect on preventing flu and other respiratory illnesses this winter, and obviously they do represent a significant number of our deaths in a normal year. We have done detailed analysis of deaths during the first 6 months of COVID-19, which shows that there were still significantly more COVID deaths than we'd normally see from flu deaths. So I'd be a little bit cautious about interpreting that too far, but that's yeah, there'll be a number of factors. Unfortunately, it will be a few months yet before we have enough data to really analyse the current deaths.
Thanks very much. Claire and Dom, over to you for the rest of the report.
Thank you, and thanks, Matt, for that. Helps us. Although it's item 5 on the paper, it gives us a nice overview, and obviously things have moved on quite a lot since the paper was submitted, so that gives you a current picture of the epidemiology. So we'll continue with this with the updates now on test and trace. Regarding first of all, community testing. Community testing is a Department of Health and Social Care initiative that offers twice weekly asymptomatic testing with lateral flow tests, also known as rapid tests. We had a bid approved from the DHSC on Monday the 15th of February to undertake community testing at the Guildhall in Portsmouth. And that's now available twice a week for everybody that needs to leave home to go to work and who isn't covered by another national testing programme. The site can test around 2,400 people a day, and it's open from 8 till 8 p.m. and 7 days a week, and you can book online. There's a number of other national asymptomatic testing programmes underway in the city, including regular testing for NHS and care home staff and other social care staff in other social care settings, private nurseries, primary schools, secondary school staff, universities and the naval base, and businesses are eligible for testing via a national offer from the Department of Health. And since this paper was written, that has now been extended to all businesses of any size, including those under 50 people. In terms of symptomatic testing options, we continue to have 2 local testing sites in the city, Eldon Road and North Harbour, and we've got a mobile testing unit that's at Portsmouth College once a month. And there's the regional testing site, a so-called drive-through site at Southampton Airport that's been there for several months. In terms of tracing, the Portsmouth Local Contact Tracing Service is now following up on all confirmed cases of coronavirus not contacted by the National Test and Trace Service within 12 hours. So they come to us after 12 hours. We received 63 cases between the 8th and the 12th of February, which is around 13 cases per day. This has currently dropped to around 6 cases per day. Referrals rose substantially during January, as you might expect, because we were seeing such high rates of infection, but these have now stabilised in line with those falling rates. We thought that the community asymptomatic testing might increase our caseload, but since this paper was written, we haven't seen the demand for that as high as we thought it would be, and that hasn't led to an increase in our local contact tracing demand either. We are consistently reaching around 88% of cases through our local contact tracing service, which is obviously in excess of the 80% of cases contacted that SAGE recommends for an effective local contact tracing service. And finally, on the 15th of February, we launched Hive volunteer support for vulnerable people, vulnerable older people, whereby those people over 70 that we can't get in contact with through our local contact tracing service are followed up by Hive volunteers. And if the Hive volunteers cannot contact them, then they are referred on to our local policing service, so sort of wraparound service for identifying cases to check that they're okay and to also support them with any self-isolation needs that they might have, such as food parcels or self-isolation payments. We've also, since this paper was written, received approval to continue community testing beyond the end of March 2021, and an options paper has been written to discuss testing options. and I'll leave it there and take questions.
Thanks very much, Dom. Jeanette.
Yeah, thank you. It's more of a comment, really. I don't think we can underestimate the achievement of the establishments in education and NHS and care homes of actually setting up the testing, because, as always with these things, it's a new process, and I think they've done a fantastic job doing that, backed up by an army of volunteers. And I say an army because they keep going and going. And anytime there's a new thing that comes in, we ask for more volunteers, and coordinated by the Hive, in they come. So I think it has been a success because of all those people that have just been driven to get it done, really. And I think that should be a matter of record now.
Thanks. Thanks very much, Jeanette. Any other questions or comments, colleagues? No, thank you very much for the report, Dom and Claire and Matt. Really, really good. I completely support what Jeanette has said. It's yet another affirmation of what the local community's been doing. And really pulling together and delivering for people in the city. So it really is something we should be very proud of, and be proud of everyone who's done that in our community as a whole. Okay, Dom and Claire, you wanted to come back in.
I'd like to hand over to Claire for our vaccination update, because we're doing this as a three-way presentation today.
Thank you. Claire, over to you.
Thank you, Councillor Winnington. So to carry on report section 4 of the report, to give an update on the vaccination programme for Portsmouth. So as you know, the NHS COVID vaccination programme is indeed led by the NHS, and Portsmouth is within the Hampshire Isle of Wight programme area. So in terms of what the programme looks like for Portsmouth, there's the community vaccination centre at St James's Hospital. We have 5 GP sites, one for each of the group's GPs, the primary care networks in the city. We have 2 community pharmacy sites, and there's also the hospital hub site at Queen Alexandra Hospital. So the hospital hub site is primarily focused on vaccinations for health and social care staff, and isn't publicly accessible in the same way as the other sites. The other sites, however, are either accessible via the National Booking Service or indeed via GPs inviting their registered patient lists. So in terms of where the programme nationally is rolled out to, there's the national groups as defined and recommended by the Joint Committee of Vaccination and Immunisation, and that vaccination programme has now rolled out to inviting down to cohort 8 within the 9 cohorts of phase 1 of the programme, which is everyone aged 55 years and over, with it being expected that it's rolled out to everyone over 50 imminently. There are 2 vaccinations currently in use in the vaccination programme in the country. One is the Pfizer-BioNTech vaccine, and the other is the Oxford-AstraZeneca vaccine. There is a third vaccine which has been approved by the Medicines Healthcare Regulatory Agency for use in the country, and it's due to enter the supply chain later in the spring, and that's the Moderna vaccine. So as you know, the Chief Medical Officer, in fact the 4 Chief Medical Officers for the UK, endorsed that prioritisation should be given to the first dose of the vaccination in order to vaccinate the greatest number of people in the shortest possible time, to have the greatest impact on reducing mortality and severe illness. So in terms of the success of the vaccination programme, clearly it's rolling out at scale and at pace, and decisions to move through the steps set out in the roadmap to ease lockdown is absolutely linked to the continued success of the vaccination rollout, and it is through that real-world surveillance of the vaccines where we'll understand much more about the effectiveness of the vaccinations, as well as other elements such as their role in reducing transmission and their duration of effectiveness. And that comes back to the point that you raised earlier around the cases in care homes, in terms of where there are cases in people who have received a dose of vaccine. That data has all been looked at nationally, so it's not lost, and absolutely informs our knowledge, as you like, of the effectiveness of the vaccination programme and how it's working in practice. So in terms of the vaccination programme, we need to have effective vaccines, and that's really good news that they're now being used. But we also need to ensure that we have good uptake, high uptake of the vaccination programme. As you know, there's many factors which will affect an individual's decision whether to have the vaccination, whether that's their own decision, their influence perhaps of their friends, family and others, as well as accessibility to vaccination sites, among other things. So much of that is featuring in our work, and for Portsmouth, we have for Portsmouth City Council, we've appointed a temporary post, which is a vaccine uptake coordinator to it, the purpose being to increase confidence in having the vaccination amongst all groups in our population. And that work will very much look at the data around uptake in various groups within our local population. And that work is intended to coordinate and work with many partners, recognising there's lots of work going on across the city to work with our community groups. For the Hampshire Isle of Wight vaccination programme, there's now a formal subgroup of the overall programme board, which is looking at equality in access, and we're working on many of those strands locally for Portsmouth. So particularly our work with regards to access of vaccines for our homeless population has been shared across the region as a good practice example to really give that cohort really good access. And that was a partnership between the Fire Service, Brunel Primary Care Network, colleagues in the City Council in the Public Health and Housing teams, as well as Society St James and Helping Hands as well. So a really successful project. We're also working on ensuring that people with learning disabilities in all settings, supported living settings, as well as those who live more independently, have good access to the vaccine, and many other groups. So I'll leave it there, but happy to answer any questions on the vaccination part of the work.
Jeanette.
Yeah, thanks, Claire. Do we know how many people have had the first jab in Portsmouth and how many people have had the second jab in Portsmouth? And it feels like the second jabs is being rolled out very slow, and a lot of elderly people are waiting for their second jab. Can you confirm what's happening with the second jabs as well?
Of course, and thank you, Councillor Smith, for your question. I don't have the exact number to hand, but Matt may well surprise us with the figures. I know it's certainly over 40,000. That was a few weeks ago, I'm sure, for the first dose. It must be many more than that now, actually. So please don't go on that. But Matt may well have the figures, or otherwise we can certainly follow up with them. With the second dose of the vaccine, obviously the programme started at the beginning of December, near enough the beginning of December. 8th of December was when the Hospital Hub at QA opened as one of the very first in the country. So the 12-week mark, so 3 months-ish following that, means that we are now starting on the second doses for those who received their first doses at the start of the programme. Obviously, as the weeks now go by, many more people will now come to having their second doses. So we are where expected. The supply of vaccine is also expected to increase, and that means that people, we do have high confidence that people will be able to access their second doses in a timely manner.
Matt, you wanted to come in?
Hey, just to add to Claire's point, I think now we're at just over 66,000 first doses now, and just under 6,000 second doses.
Thank you very much. Any other questions or comments on the vaccination programme? I just really like to say on this that I think that the response from the various wings of the NHS in providing the vaccinations has been absolutely fantastic, and I think that I'm sure the same is from colleagues, but feedback from residents who have had the vaccination, they've been extremely well taken care of. It's been a very smooth process, and really it's really worked extremely well. And I think I think we also should pay tribute on a more national level to the military and the national distribution network that has been working in lockstep with the NHS, because without that, I think we would have been in nowhere near as good a state to actually be able to get the vaccines out to people as we have done. So yeah, so really is a brilliant job all round for the NHS in particular. Thanks very much. So next section, who's taking that one?
I'm happy to if Dominique.
Oh, there she is.
There she is. Do you want to cover that section, Dominique?
Okay, so just the final section really goes over the Health Protection Board and the local outbreak engagement board. Obviously, they were established following the announcement in June 2020 for local outbreak control plans, and those outlined the need for local plans centering on those 7 themes listed in the paper in terms of planning for outbreaks, identifying and planning how to manage high-risk places, local testing, local and regional contact tracing, integrating national and local data through what was then the Joint Biosecurity Centre playbook, supporting local vulnerable people and establishing those governance structures. And the Health Protection Board and the local outbreak engagement board were part of that governance structure. Terms of reference were agreed for both of those groups in late June or mid-June last year, and then September the local outbreak engagement board was met 5 times and has a regular assurance board that we keep updated. It will continue to meet on a monthly basis, receiving reports that summarise the work of the local Health Protection Board that meets weekly, and it's a really useful way of providing that assurance from members and other staff and bodies to give us that assurance to make sure that we're on track for our response. And I should say that we've also last week been asked to submit a refreshed outbreak management plan, local outbreak management plan, that's the right acronym, and that was at the request of DHSC, so we'll be able to share that as well when it's been approved.
Thanks, Dom. Any questions or comments? No. Just on the local outbreak engagement boards, that's one of the things I have the pleasure to chair, and I'd just like to express my thanks to everyone who's been involved in the outbreak engagement board and also the health protection board as well, which sits underneath that. Again, it just shows the real partnership working, both of officers, organisations outside the council, so NHS, schools, fire service, police, rest of the voluntary and community sector, including coordinating through the Hive, but also members from across party. It's really does make a difference when we're tackling this united as one as a city, and it really enables us to do the very best. So just a huge amount of thanks to everyone who's been involved in helping the city through this pandemic. We now have the end in sight, but we still have a long way to go. So thanks to everyone involved, and thank you to the public as well, because you've been absolutely fantastic in terms of looking out for everyone. So whether you feel like you volunteered or not, most people probably have, because they've helped out their neighbours, their friends, whoever they might be. It's our real community in Portsmouth, which makes me very proud. Okay, right. Thank you very much. Public health. That's been really good reports. Really shows everything that's been going on, the incredibly hard work the public health team has been doing. So thank you very much for that. So we're then going to move back to agenda item 3. Which is adult social care discharge to assess provision. So I'll ask Andy and Richard Webb to introduce yourselves, and then I think Andy's going to be presenting the report. So Andy.
Thank you, Chair. Good afternoon, members. I'm Andy Biddle, Director of Adult Social Care for Portsmouth City Council.
Good afternoon, I'm Richard Webb, Finance Manager for Adult Social Care and Public Health.
Thank you very, very much. Very welcome. Andy, over to you.
Thank you, Chair. So the report's before you about adult social care discharge to assess provision, those people coming out of hospital who need somewhere to stay to undertake an assessment of their needs. So the report is formed to inform of the intention to extend arrangements for the Southsea unit that's based at Harry Sotnick House for discharge to assess facility, and to then assess the future use of the Victory unit, which is based at Wiley Road in Portsmouth. So the background to this particular report at the base of page 1, we set up a unit called the Gunwharf unit at Harry Sotnick House in June of last year, for the purpose of caring for people in isolation who came out of hospital, those people who were COVID positive, in response to a government action plan that had been published in April. We then received updated guidance in October of last year around isolation care, something called designated settings, and that spoke to anyone who had a COVID-19 positive test needing to be cared for in isolation from anyone else being discharged from hospital. And that those accommodations, known as designated accommodations, needed to be inspected by CQC to meet the latest infection prevention and control standards. So in November of last year, CQC visited the Gunwharf unit, agreed that the arrangements in place were appropriate and suitable for people to receive care in isolation and to prevent the spread of the disease. We needed to therefore make arrangements for those people who did need to be assessed on discharge but couldn't stay in that unit because they were either didn't have a positive COVID diagnosis or had been in contact with people who did but still hadn't tested positive. So we had a significant pressure building at Portsmouth hospitals at the time for people waiting for discharge. There was a lot of people who had been admitted. Wave 2, as we called it, was more severe than wave 1. Saw people staying in hospital for longer and more people admitted to hospital and needing intervention in terms of oxygen and that kind of thing. So we had to take a decision on how we best deployed our resources in adult social care in Portsmouth to meet the need to bring people out of hospital in a timely way so that hospital could admit and treat people who were severely ill at the front end. So we made a rapid move of staff from the Victory unit at Wiley Road to the Southsea unit at Harry Sotnick, and the table at the base of page 2 and going into page 3 illustrates the risk assessment that we made at the time on making that move. It was quite a significant move. In all, it was 9 days for people to be discharged from the current Victory unit, to move all of the staff over to the Southsea unit and then to reopen for admissions. Quite a significant effort on everyone's behalf, really, and enabled us to move more people through our discharge to assess facilities, get more people through, enables more people to come out of hospital and achieves that objective in the hospital to admit more people and care for them when they needed acute hospital care. So on 18th of January of this year, we closed the Victory unit. We transferred all of our staff and we opened up the Southsea unit. So our length of stay for Southsea is projected to be 14 days as opposed to a 6-week length of stay at the Victory unit. And so we've maintained a current average length of stay of around 10, and 50% going through the Southsea unit. People are discharged to their own home, which would always be our objective wherever possible, and safe for people to return to their own environment in terms of independent living to avoid institutionalised placements. And that's been a long-term aspiration for adult social care, both locally and nationally. What we'd like to do is take some more time to review the data, because obviously we've only got a couple of months data since this happened in mid to late January, to make sure that we are able to maintain that people are getting the right optimum outcome for them. And we're also able to provide more rehabilitation in their own homes post a couple of weeks stay in the Southsea unit. There's some figures in the middle of page 3 there, measuring from 28th Jan to February, the number of people we had medically fit for discharge in the acute hospital, average of 13 a day. And then over that same period this year, 2021, an average of 5 a day, with number of bed days lost 16. So you can see from those figures really the reduction in people waiting in hospital has been quite significant, and that's been supported very much by having the South Sea unit there. So our options to deliver discharge to assess going forward are to permanently establish the South Sea unit to do all of those things that I've just illustrated, and to think about whether we're moving from a 6-week reablement offer to a 2-week reablement stroke discharge to assess offer. In terms of bedded capacity, reablement obviously continues at home. And consider that on a permanent basis. And I've listed at the base of page 3 and going into page 4 the advantages and disadvantages in very brief terms. We feel the advantages: we could make economies of scale. At Harry Sotnick, we could have spread the use of our resources in terms of social work, nursing, therapy, and we could also fully utilise the top floor of Harry Sotnick. In terms of disadvantages, I've listed at the top of page 4. There will be a certain instability for staff. Staff have coped very well. We haven't seen anyone leave the service as a result of the move. And we are continuing to discuss with our staff on a very regular basis what our future plans are, how we're assessing them, that sort of thing, to try and help them feel as informed as possible. There are some financial advantages to making that change, that permanent change. It's not huge. But it would be, in terms of value for money, potentially, if the figures are right, if the data is right, then that could be an advantage as well. Our second option is to return to where we were once the pandemic support is complete, and then retain both Victory and the current Gunwharf unit in their current locations with 2 different sets of criteria. And at the base of page 4 there, I've listed out the advantages and disadvantages of that. What we do want to do, though, is not make a decision yet. As I say, we need to make sure we've got the right data. We need to make sure that it's right for the people of Portsmouth with care and support needs. And we need to make sure that we can make it as right as possible for staff, if that's the option we choose, and ensure that we've got all the right governance and the right procedures in place to make that a success. So we want to give it a few months to give us a very clear idea of whether that's the right thing to do or not. So we'd propose to continue with gathering information about discharges, about the where people end up after they've been through discharge to assess, about the outcomes for them in terms of their ability to access reablement services, and we'd like to come to that decision later on this year as to whether we keep the unit there permanently or whether we revert to the previous arrangements. That would also enable us, in the last paragraph there on page 5, to make a financial assessment of the options available for the Victory unit. We lease that currently. It's in an existing building. We also have some obligations to provide certain catering facilities for the residents of that building, and we'd need to think about what that space could usefully be used for and how we'd financially support that use, whatever it were. We think that pausing to consider our options is not only the right thing to do to get the right level of data, but we're also anticipating some instability in the residential care market, and we briefed on this before. And so what we'd like to do is also keep the Victory space in the very short term as a potential contingency space if we needed to have a space to care for people if we saw provider failure in the market. And we think that's a sensible contingency option over the next sort of 4 or 5 months. That's the body of the report, but as always, happy to take any questions that members have.
Thank you very much, Andy. A very comprehensive report there. Any questions at all from members? Graham.
Thank you, Matt. Just to clarify on page 3, when you talk about the change from a 6-week rehabilitation stay, are we convinced that it's no longer necessary to have such a long stay or to be placed for such a long stay? And is that a sort of permanent change that will happen regardless of whatever the options are decided at the end of, well, in the autumn?
I don't think it is. I think we've had that model for a long time now, since the Victory unit was opened. And what we've seen over time is that sometimes it doesn't get used for the most efficient use. So sometimes people end up staying at Victory because there aren't other opportunities for them to move on to, for instance, permanent housing, that sort of thing. So the evidence is a bit mixed about the 6-week period. What we'd like to do instead, if it's possible and if it's the best thing for people, is to extend that reablement period at home. So I think that's part of our decision, really, although it's not directly related necessarily to Southsea and Victory, is if we can still see the right outcomes for people, then can we move away from that 6-week bedded option, if you like, because people often do very well in their own home because they're very familiar with the environment. And we see a lot of evidence where people need a lot more care when they first go home from hospital. But then in the next couple of weeks after that, they re-establish their familiar routines, they re-establish their coping and managing routines. And so that some rehabilitation at home is just as effective as if they were in a bedded unit. So I think that's a decision that is wrapped up with all of this. I think we wouldn't say no or never, because that would be foolish of us. So we need to see what the evidence tells us.
Okay, thanks.
Thanks, Andy. Any other questions or comments? No, I'd just like to say I think the work that's gone into making sure that this smoothly works, going from Victory to Harry Shotnick House, the Southsea unit, was extremely well done. I think, as Andy said, there's been no one leaving the service, and this can be very distressing for staff. I think that's a real testament to the relationships and the work's done within that to move them across. And obviously we've been having discussions about this since that happened, to make sure that we're doing this in a considered fashion rather than rushing into any decisions now, which is very sensible. And making best use of our resources across the city, I think, is the very sensible thing to do, and that we shouldn't be doing anything in a knee-jerk way, but recognising that we have resources available, we have real expertise within our care sector, and particularly within our staff within the council, who are flexible and able to do things. But also it's about that larger piece of work we've been doing for the last couple of years, looking at where our gaps in provision are, and if we can, whatever comes out of this, whether it's the Victory unit or what's in Southsea at the moment moves back to Victory or whatever, it will still mean that we can look at our capacity within the city, see what's missing, and making sure we can fill that as much as possible. I think one of the areas we've talked about, we've got this long-term aspiration of having all the extra care that we need in the city, so that could be something that we might be able to move on, or something else, because if there's other things that, as Andy said, the evidence comes through, we do more work on this, we might find that there's other needs that crop up that we could use our estate for. So yeah, thanks very much for this and for all the work of the team in that area of the council.
Thank you, Chair.
And finally, on to agenda item 4, Andy, which is the so just get it up, which isn't playing. There we go. The adult social care response to COVID-19.
Thank you. So this is the third of our updates. We were talking to Councillor Willington earlier on, and we presented one May, June, one in September. Excuse me, and this is the third one. Just to give a narrative really around the adult social care response to the COVID-19 pandemic. I've tried to keep the themes fairly consistent throughout of some of the major things that have been either challenging to the service or challenging in the city, and so to try and give you a sense of consistency as we go through. So this report summarises some of the key issues in the work undertaken. And it's worth stating that this is always in conjunction with colleagues, because ASC in Portsmouth, as we know, never operates alone. I mean, we heard from our public health colleagues earlier on, who I don't think we could as a city have had the response that we've had without our public health colleagues. They've been absolutely central to the response from Portsmouth, as indeed have been our NHS colleagues who work very closely with us. So our focus in ASC is governed by government guidance. We operate according to statute and government guidance that comes off the back of that. We saw in March, we reduced or closed some services considered at the time non-critical and redeployed staff to be able to manage the pandemic response within adult social care. And that then changed as the national lockdown eased. And as we went into the last lockdown, we determined to try and keep as many services open as possible, because in the first lockdown, where we closed some that weren't as critical as others, there was nonetheless an impact. Those tended to be services that provide unpaid carers with respite. And so we wanted to try and maintain all of our services this time. And I think with the exception of day service for around about 4 to 5 weeks, we were successful in that, which is a real testament to the staff in trying to keep those services going and trying to keep breaks for carers going. It's really important stuff. So moving into the second page of the report, personal protective equipment, we still have a strategic reserve of PPE. So we are still able to supply any critical need within the care environment or the care sector. We also supply, of course, a lot more PPE to our staff across the council who are involved in working with members of the public. And it's fair to say that that was a very early success story in that we established that when the supply line for PPE was in doubt. And it was difficult to get the right supplies to the right places. And so care homes in Portsmouth were well supplied and well supported by the council. In terms of hospital discharge, we've seen 2 updates to the hospital discharge guidance, and we're anticipating a further update in the recently published white paper that's due to be laid before the Houses of Parliament around assessment and discharge to assess in hospital. We don't know the shape of that as yet, but we imagine it will very closely resemble some of the arrangements that we've made during lockdown, which is for people to leave hospital in a far more timely way, quicker way. We've seen significant progress by appointing a senior responsible officer between ourselves and Solent NHS to help manage discharge and flow. And based on an agreement between ourselves, between the 2 organisations, that officer, who's an officer of the council, has been able to direct resources from both organisations, which has given us a much more cohesive effort to help people get out of hospital quicker and safely. And that's been really positive. As you know, we've shared posts across with CCG colleagues in the past, and we've also got leads for various services on both Solent and the PCC side. So that extends our integrated arrangements. We've seen a significant increase in people who are medically fit for discharge, but we've also seen an effort and a successful effort to sustain less numbers in hospital waiting for services, and to decrease what is known as lost bed days, so the length of time that people stay. And despite very challenging circumstances at many stages, particularly in wave 2, we've been able to maintain those numbers, which is really, really positive. In terms of care environments, one of the most significant impacts has been the effect on care homes. We've seen people be very unwell. We've seen the suspension of visiting and really tough stuff for people to take, both those care home communities, the people that live there, the staff that work there, and the families that cluster around those care homes. It really is an extended community in any residential care home. We had a reasonably successful period of outbreaks in a reasonably successful period of no outbreaks, in our PCC managed and run care homes until January of this year, when we saw a small outbreak at Shearwater. They've come out of that, and then we've seen another small outbreak recently. As I alluded to earlier, we felt that there was probably an effect of our residents having been vaccinated in the final week of the last year, because we saw one resident go to hospital and they were subsequently discharged back, which was really positive, so that our resident population came through that outbreak without long-term harm, which was really, really positive. We've also seen outbreaks across the city, although those are now reducing. We've seen a couple in the last couple of weeks, but generally speaking, the supported living environments have opened up again, because we had 4 of those closed at one stage. And I think from memory, we've got about 3 of our care homes across the city closed to admissions currently, which doesn't have an impact on capacity and being able to place people. And we have no requests currently for extra staffing, so that's really positive. I've spoken earlier on about the discharge to assess facility at Gun Wharf and at the Southsea unit, both for people who are COVID positive on discharge and people who aren't. And then I've detailed in the second paragraph there on the third page of the report about the move to Southsea. We do still have an ambition to establish a permanent D2A unit. Now, whilst I've spoken about Southsea, I haven't spoken about Gun Wharf because that's not been the subject of any of our reports today, but we continue to be in discussion with our CCG colleagues, as Councillor Willington alluded to earlier, about where in the city we have our bed stock, if you like, and what support that bed stock can provide, what needs it can meet. And so that's a continued conversation across Health and Care Portsmouth to make sure that we end up with the right number of beds in the right places, and that includes Gun Wharf. So I've no doubt that we'll bring a further paper in due course relating to the future of Gun Wharf. In terms of financial supports, we don't think we're going to see any more state aid for the care sector. And so this should be a reasonable summary of what we've seen in total. So for Portsmouth itself, the combination of the infection control grant, the rapid testing grant, and the workforce grant is just over £3 million directly distributed to the sector in Portsmouth. And in addition, locally from Portsmouth City Council, £1.3 million as a combination of PPE in the early days of the pandemic, increased staffing before those two were taken care of by a government grant, and a minimum income guarantee that kept the income of care homes at the level that it had been pre-pandemic. We're anticipating in a couple of weeks now that the NHS funding that was provided, known as Scheme 2, for people to be discharged from hospital will cease. What we need to then do, or we need to do in the run up to that, apologies, is to make sure that we have arrangements in place so that if people aren't going to the discharge to assess bedded option, which is currently funded through NHS, that we understand what the option is for people returning home, and we ensure we give people the right information about charging and make the right arrangements so that we keep seeing the flow from hospital as smoothly and as safely as possible. It's very likely at the base of page 3 that we're going to see an after effect in terms of the need for people in Portsmouth with care and support needs, and that will translate into financial draw on the council's resources, we believe. It's difficult to say at this distance where we'll end up, but we certainly have a fairly persistent 3% increase in domiciliary care, more so than we normally expect. We also currently don't have a long-term clear plan for adult social care in England, and we're awaiting that. It's been committed to again this year. When the white paper was published, the DHSC, Department of Health and Social Care, said that it would bring forward plans in this Parliament for social care, but we've not seen any detail of that as yet. It's fair to say that at the moment, a great deal of social care funding nationally is allocated on a year-to-year basis, which doesn't really give the opportunity to plan properly and appropriately for getting it on a sustainable footing. In terms of testing, public health colleagues have very kindly already highlighted much more detail than I do here, but I've just put a brief paragraph there of the range of testing that's used in care environments and for care staff. My report's been overtaken by the announcement on testing for personal assistants, and that's happened since I wrote the report. I think it's probably fair to say most places that would be related to a care environment are now covered by some kind of testing regime or the ability to gain a test for COVID-19. And then vaccinations, again, public health colleagues have given a far more detailed update, but we saw larger care homes start to be vaccinated in the last week of December last year. We've had a very successful uptake in the care home population in Portsmouth. We're starting to get more success in terms of care home staffing. The week before last, I think we were about 71%. Last week, we went up to 77%. And we continue to share all of the resources that we see around vaccine hesitancy, trying to encourage people to have the jab, those kind of things. And we have a very regular interface with care home managers in particular and domiciliary care agency managers to talk to them about trying to encourage their staff to have the jab if they've got concerns. And public health colleagues have worked tirelessly to ensure that we can ensure that vaccines are promoted, excuse me, in our faith communities and delivered in appropriate place in the community. excuse me. Finally, very sadly, across the city, we have seen further deaths due to COVID-19, and Matt went through the excess death figures earlier on. It's not really possible to convey how deeply this affects people with care and support needs and their families, and the wider family, especially clustered around care homes, because even if your person isn't there anymore, you often see families still continue to visit because they form relationships, and that's part of that community. And there's been a real impact, and I know you're aware of that, and I know you've seen it in the national and the local media as well. So we continually consider the range of support that we try and offer, both care homes, our own staff, and anyone else affected by these issues. And of course, we know or strongly suspect that we're going to see a need for greater mental health support, certainly post-lockdown and in the wake of wave 2 of the pandemic. And we're aware of that and sort of talking relatively continually about that. And we try to manage that and try to help people come to terms with their experiences. That's a broad summary of the report. As always, happy to take any questions.
Thank you very much, Andy. Jeanette.
Yeah, thanks, Andy. In regards to the white paper, I'll probably be in residential care myself before that comes out. So I'm interested, obviously, in your thoughts about the mental health issues that you've just gone through so eloquently at the end of the report. What concerns me is if the private sector starts going under and closures because they are either underfunded or they don't have enough resources going forward, or they get to burnout stage, and how that would then affect Portsmouth going forward with the offer that we can sort of then make. So we've talked through the year about sort of the stress levels, and it's whether we have to sort of wait until post-pandemic or whether we can do something now. So just interested in a bit more of your thoughts on that.
Yes, of course. I think what we've tried to do throughout the pandemic is be very flexible in the support we offer. So as a council, of course, we've done quite a lot for our own staff in terms of resources around wellbeing, making the employment assistance programme very widely accessible to those people in need. And of course, everyone has very different levels of support and need. We also did that with our care home providers, where we identified with care home providers themselves that there'd been a real impact on some of the care homes, either through deaths or hospitalisations or whatever it was. We extended some of that support and enabled them to access that support. So that's what we did in the middle, if you like. I think post-pandemic, the impact on mental health, although it's going to be very different for different people, I think we need to understand how we make fairly basic mental health, self-care, those kind of things available to more people. Now, we know we've seen a lot around a digital offer in the pandemic. We've had to, because of that close contact risk for people. And so whether we can exploit that kind of resource for people, thinking about very much the self-help spark, if you like, helping people to help themselves. We've done some of that in our staff team as well. We had, for instance, a practitioner with a particular interest in wellbeing who we said, have however much time you need during this working week to go and do some research and then come back and help your colleagues with that. And so there's those discussions going on with our independent care home sector providers as well. I think the bit about if we see provider failure, which I think was the second piece you were talking to, we know that we've seen pre-pandemic, we've had an oversupply of care home places in the city. During the pandemic, the government and the local aid combined, I think, has propped the sector up and has meant we've had no failures, we've had no closures during the pandemic at all. And I know that's replicated, I think, in Hampshire with its vastly more care homes than we have. I think there's only been 1 or 2, whereas they'd normally expect more. So I think the art now, very difficult to do, is to try and manage that market and help the providers manage that market so we have the right provision going forward, but not an over provision. We've also been working, as you know very well, I think, to help far more people stay at home and live at home and be cared for at home rather than defaulting to residential care. And we've opened up a lot of extra care support. We're planning for the extra care on the Edinburgh site, all those kind of things. So I think we've got a real job of work to do try and figure out with the sector how we try and manage, if there are providers that want to withdraw from the market, how we try and manage that safely. The allusion I made earlier to keeping that space at the Victory unit is one of those things. We've also got spaces we know in, or planning for space in Shearwater, to give us a bit of contingency so that people can still be cared for if we do see a failure. And we're also, the addition of some of those extra care spaces into the market, where people who won't now go into Shearwater because we're closing that floor, may also provide a bit of stability. It won't prop the whole sector up, but it may help. So I think those are all of the things that we're trying to do to manage the risk to individuals of provider failure, but also to providers themselves. The problem is it's not a perfect thing to do. There's no perfect solution. We haven't got all the levers, but that's what we're trying to do.
No, thanks for that, Andy. I know that's something we're sort of looking at, and I'd like to, personally thank you as well for all your hard work during the last year and more, because I think without you at the helm, I think we would have had an even more difficult job. So thanks from me, and I'm sure other committee members will do the same.
Thank you. That's very kind.
Thank you, Jeanette, and thank you, Andy. Graham.
Yeah, just a couple of questions. On the first paragraph, you talk about the provision of PPE. It's going to be continuing from the government until July. I'm just wondering if we know what's going to happen after that. Is it anticipated that care homes will go back to their normal procurement processes? And will we still continue to have a reserve in case there's any issues with supply through normal procurement? Is that sort of plan for how we were going to deal with the post-July situation?
I think
Sorry.
I think we don't know at the end of July in terms of the government. This isn't a difficulty now, obviously, but as we move into the summer, it will be, because we know care homes so to be very basic about it, care homes would have used gloves and aprons, and certainly gloves in all cases, but gloves and aprons in others pre-pandemic. But gloves, aprons, face masks, hand gels, all of the infection prevention and control procedures and the cleaning materials that people have had to bring in wouldn't have been such a feature. So there is a considerable burden of PPE, and that'll remain. I can't see that changing, to be honest, post-July, because I think and this is my observation, from what I'm hearing, from what I'm seeing, as I'm sure you all are, whilst we may relax lockdown restrictions, I don't think we'll be relaxing hands, face, space anytime soon. There's still going to be quite a virulent risk of outbreaks again. So I think that will continue. I think as a city council, what we've said to this point is we'll make sure we've got a strategic reserve, because whilst external sources may not be relied upon, we will be relied upon. I think we'll probably dial that down a bit, and this is my assumption, I don't know this for a fact. I think we'll probably dial that down a bit coming into the summer, because we don't have providers calling upon us at the moment. But I think that'll be a decision point for us as to how long we keep a reserve. Certainly we've kept it all the way through, even when care homes weren't calling on us, just in case. So I think that's a decision to be made.
As I asked a question, because we'll probably have to meet again July time to get that question in now. My second question was really just to get a bit of clarity around the medically fit for discharge paragraph, because obviously more people going in hospital with COVID, coming out now ready for discharge because they're medically fit. But you say in the figures that we're 50% less than March last year. So what are the key reasons that are preventing people? Because presumably it's not because they haven't been assessed, because they're assessed and they're ready to discharge. So what's the key thing holding up discharge and making it less than last year?
Well, it's a positive, really. We've seen less people waiting. That was the point, because they're coming out quicker. So what happened? The broad combination of factors was NHS funding. So because social care is a charge for service, there's an assessment, but there's also a financial assessment. Neither of those things need to happen at the moment because of the NHS funding. So the assessment happens outside the hospital. There's a brief risk assessment because you'd need to know where it was safe for someone to go. But it's not a full assessment and doesn't involve a financial assessment. So that's partly increased the flow through, if you like, of folk. That's why we're maintaining it at less people waiting. The other thing relates to that senior responsible officer. By bringing both teams that were working on discharge together under one individual, you cut out some of the miscommunication, you cut out some of the not intended but natural consequences of having two different teams trying to do the same thing, if you like. And so that's been very successful. The complication with discharge, and we're seeing it at the moment actually, is that people can be seen as medically fit, and there's something called criteria to reside, which the NHS uses as a guide for who should stay in hospital and who should go. But it can be transitory. So somebody may be seen as fit in the morning, but not be fit in the afternoon. And certainly we've seen a lot of that fluctuation lately because, of course, people have been far more unwell in the second wave. And we're dealing with people who have what they call comorbidities, who have several different conditions anyway, when they go into hospital. And so discharge is a complicated beast, to be honest. But the reason that we've maintained that low level of people waiting is that NHS funding and that very seamless team approach, I think it's fair to say.
Okay, right, thanks.
Pleasure.
Thank you very much. Any more questions or comments? No. Thanks very much for that and for everyone's contributions. I think the report is a really good summary of all the work that's been going on within adult social care on a very holistic basis. We've looked at how the fantastic work that public health have been doing, but also the fantastic work that adult social care have been doing, and again the real importance of partnership working. I'd just like to pick up on Jeanette's point about mental health. So within the Mental Health Alliance that I'm the councillor's representative on, and obviously the Claire Curry is co-chair of the Shaping Portsmouth are there, and the wider care and health and care sector are involved as well. But the independent care market are linked in with Shaping Portsmouth, and we're making sure that everything's going out to businesses, whether they be care sector, retail, office space, whatever there might be within that care sector, and there's a really good network there as well of businesses being able to support each other, as well as being the support and the conversations we're having through our care provider meetings, which are very regular as well. So we're sort of hitting and including people from all sides on there in terms of mental health, and Jeanette, you're quite right about the importance to make sure not just our people who we're caring for their mental health is looked after, but also our the staff as well who are providing that care and support, because if they're not in a fit state to care, then the care will not be as good. I'd also just like to dwell on that wider piece that Andy was alluding to in terms of the care market as a whole. Again, that engagement, I think I've said it before, but the engagement with the care sector throughout this pandemic, we had a close relationship, but that relationship has been ever closer. And I think the work that's been done from the council, from care providers as well, and working with each other within that care sector has been absolutely brilliant. And they have gone out of their way to look after the most vulnerable people in our communities under enormous amounts of stress and distress, because when there were outbreaks and people were dying of COVID in their homes, the amount of stress and distress that puts on staff members should not be underestimated, and also obviously on family members as well. And they have coped magnificently. And I think the real thing we have to do coming out of the pandemic, and this goes into what Jeanette brought up earlier, but is really make sure that we recognise all of our care services in the city, that they are key workers, that they are the very, very basis of our city and looking after everyone. And that if we don't take those seriously, we're bereft. I know this is something we've been considering for a long time in terms of, way before this we were saying care sectors should be regarded as key workers, but all the more we have to make sure that we recognise that in every way, and also work with the care sector to show that working in the care sector is a career and is a really worthwhile thing. And I know how keen everyone in the care sector is to do that, and it's the onus is on us as elected politicians to really support that and promote and support the care sector, who have been absolutely magnificent. So I'd absolutely like to back up as well the thanks to the whole of the adult social care team throughout the whole of this pandemic. And I'd also like to again thank all of you and the cross-party support that's been given to our social care teams, both children's and adults, because that really has enabled us all to work together and really promote and support everyone in the sector, and by extension the people who are being cared for. So I'd like to thank everyone who's been involved. It's not over yet. Again, we've got a long way to go, but if we can come out of this stronger and with closer working relationships, then I think we've gone from what was a really, really difficult time to actually being a place of strength. I don't think many places have been able to do that or be in the position where we are now. So really thanks to everyone. Unless there are any further comments or questions, I'd like to thank everyone for coming today, and that concludes the meeting.
Shall I stop the live stream now?
Please do.
Yeah, you'll still be audible for a couple of minutes.
Thank you.